if a person is eating glass, they're literally eating glass, right? They're chewing up glass and it's painful and they're swallowing it, it's painful and it's causing them all this pain. And they go to the doctor and the doctor says, well, here's some pain medicine. So you can keep eating glass and it
Right.
won't hurt as bad.
Right.
Right. And that's the way, instead of saying, stop eating glass.
Right. I've been saying the same thing for years. I was saying that you go to the doctor and he gives you pain medication, but you whack yourself with a hammer on your arm, and the next day you do it again and you whack yourself with an armor and you take more medication, keep going back, and you still hit yourself with a hammer. It's the same thing. It's like people are slowly destroying their health, but they're not just, they're not just dying prematurely. They also suffer for decades with mental confusion, depression, all types of confusion. They're not thinking as clearly. They lose their intelligence. They lose their, and they don't feel well. Everything from indigestion to poor sleep to have trouble with bowel movements to body pain. It's people are suffering, and they don't make the connection because the medical profession gives you the idea that drugs are the answer to everything. People go to,
the drugs give them additional short-term and long-term side effects that ultimately make them worse.
And they're the effects of the drugs. They're not just the side effects. They're in other words, the effects they like, they call them side effects, but those are really the effects because drugs inherently are poisons. In other words, I'm not talking about insulin replacement or thyroid replacement. That's not working by a poisonous mechanism. But most drugs for autoimmune conditions and even blood pressure medications mostly have carcinogenic effects. And they work by blocking or interfering or poisoning natural body activities in order to have what they call efficacy, which is the efficacy is from the poisonous effects of the drug. We even look at natural substances from nature, and the efficacy of pharmacologic natural substances, herbal products, are due to the toxic effect, not the nutritive effect. The toxic effect is the only thing that can make your pain go away or make your heartbeat go faster or slower, make you urinate more or urinate less or kill an infection. It's all due to the toxicity. And people just have no warning or no level of caution with throwing poisons in their body. And one thing I'm very cautious about, because you mentioned the word rice. I'm concerned about that of late because the brown rice is contaminated with arsenic in this country. It's one of the most highly arsenic contaminated foods we can eat is brown rice. And so it's one of the things I'm choosing to eliminate. Arsenic's in a lot of different things, but it's a carcinogen. And so many people I've been detecting high levels of arsenic in their tissues, even people on healthy diets, and particularly when they're eating rice. And the second thing we're fearful of nowadays more than ever is seafood. We used to think a little bit of seafood was okay, but now we're realizing that it's not just the big fish with mercury like shark and tuna and swordfish. It's even the small fish that live near the coast that are full of microplastics today. And a lot of people have plastic contamination. They have plastic poisoning in their body, and they carry around a credit card or more of plastic within their tissues because they're eating so much seafood. It's not the only source of plastic, but it's the major source of plastic today in your body. And then this microplastic go into your bloodstream, get impregnated into your tissues, and are very, very dangerous. So we have all these risks, and people are unaware of them, and they're causing. But we also, have this opportunity to have organic food, and to more than ever before, and to understand the foods that have the most powerful effects to support immune function and to protect immune function and to protect the normal and to protect against cancer. So we have tremendous amount of information on both ends of the spectrum. Tremendous amount of information of what we shouldn't do and tremendous amount of information about what we should do. And you're kind of like a little bit something wrong with your thinking if you don't take advantage of modern nutritional science.